Thank you, Sue, and it's always a pleasure to be here. And I always try as hard as I can to support this excellent platform that's so flexible, that's responsive, that's contemporary, that's in people's homes, in people's pockets, and in people's hands, wherever they happen to be. So delighted to be here. My name's Jacqueline Dunkley-Bent, as Sue has shared, and I'm the currently the Chief Midwifery Officer for the NHS in England. And I'm just going to share with you. I'm delighted to be here, and of course, I'm equally delighted to be sharing a platform with Wendy. And I'm sorry that our amazing Professor Leslie Page isn't well. Because we do have a little bit of a double act story to tell. At some point we will tell that story together, but for now I wanted to share with you some of my reflections about being the first Chief Midwifery Officer for the NHS in England, a little bit about what I've achieved, and then a little bit about my thoughts about the future. So as many of you, or some of you know, I became the first Chief Midwifery Officer for the NHS in England in April 2019. I'm one of 2 National Maternity Safety Champions. I'm soon to be the Chief Midwife for the International Confederation of Midwives. And that soon to be will be in a few weeks' time. So I just wanted to share just a little bit about where I've been over the last 4 years as your Chief Midwifery Officer. And it's an honour, again, to be able to address you in this way. So if I look back then, I think, first of all, and this is all running in parallel, actually, because remember, I probably had 11 months of bliss, of planning, of really exciting times. And then the pandemic hit, the COVID-19 pandemic hit. So this is all that I'm going to share with you within the context of the pandemic. And, one could say when a pandemic of that nature hits, an unprecedented, absolute, challenging time for all of us, we could either throw up our hands or roll up our sleeves. And I chose to roll up my sleeves, as many of you did too. So as well as supporting on the front line, working clinically, I also, as the new Chief Midwifery Officer, 11 months in, decided to build and grow as I walked through and supported these maternity services during the pandemic. So I built and grew the midwifery infrastructure at NHS England, and that included the development of job descriptions, finding resource fundings, business cases for 2 deputy chief midwifery officers, 7 regional chief midwives. And for those of you that aren't aware, why is there 7 regional chief midwives? It's because the NHS in England is in 7 regions. So I felt we needed a chief midwife in each region. So that meant writing JDs, having agreement with colleagues about the content of the JDs, finding money, business cases for salaries, etc. And then, of course, didn't want to stop there. During the pandemic, also built the infrastructure for 7 deputy regional chief midwives, and didn't stop there. Working across the professions, including supporting my obstetric colleagues, we recruited, or he recruited, I supported that, 7 regional obstetricians. So we have 2 deputy chief midwifery officers, 7 regional chief midwives and their deputies, and 7 regional obstetricians. And what does that do for you? That supports guidance, advice, surveillance of maternity services across each region in the NHS in England. It also provides an infrastructure for you. So in developing these roles, I was cognizant in thinking about those thinking about becoming a midwife, those who were already midwives, and what could they see for their futures. And this is an option. Somebody in this meeting right now may well be the next chief midwifery officer, or indeed a regional chief midwife or a deputy regional chief midwife. So a new career structure for our NHS in England. There's quite rightly, as we built, there's quite rightly been a focus on maternity and neonatal services, with the independent report showing that some families have experienced unacceptable care, trauma and loss. And there continues to be many challenges, of course, globally when it comes to maternal deaths, stillbirths and newborn deaths. In fact, global estimations tell us that there are some 810 maternal deaths every single day, one stillbirth every 16 seconds. And so you can see a little bit why I was really keen to join the team at the International Confederation of Midwives, because I do believe a difference can be made globally, but we have much to do here. I can't talk to you without mentioning the, as Sue alluded to, the new delivery plan for maternity and neonatal services. Now that plan was published some 3 weeks ago now, and the aim of the plan is to support the provision of safer, more personalised and more equitable care across our maternity and neonatal services for women, babies and their families. And so that plan, Sue's alluded to the fact that it isn't onerous in terms of reading. We did an awful lot of stakeholder engagement, meeting with you, meeting with families, meeting with seniors in the daytime, afternoon, evenings, to scope your views about what should be in the plan and what it should look like. There will be nothing new in the plan, and I think I need to say that for those of you that haven't read it already. It is a culmination of Better Births, the report of the National Maternity Review, the NHS long-term plan, the maternity chapter within that, the Ockenden interim report, the Ockenden final report, the East Kent reading signals report. It makes a reference to the 3 equality reports that were published last year by 5 times more, the Muslim Women's Network and Birthrights. And so it contains nothing new, but it contains everything in one place, and we'll work toward delivering on this plan over the forthcoming years. Of course, midwives, you and support staff are central to this ambition for improvement in safer maternity care, neonatal care, safer and more personalised and more equitable. And so midwife support staff are central to this ambition. And this is why your work continues to be so important. And this is why in the national team, we're always mindful of improving experiences. But to do that, we must invest in you. You have a significant contribution to make. And what you do will ripple through generations. Many of you have heard me say this before, and I will never tire of saying this. Midwives, the impact, the process, the impact will ripple through generations. Your contribution is significant. And this is why, since I started my role as the Chief Midwifery Officer, I, with colleagues, have secured funding to increase the number of people working in maternity services. So to date, we have funded, this doesn't mean people, this is money, we've funded an additional 1,682 midwives. 311 obstetricians, 387 maternity support workers, and over 550 neonatal nurses, plus the retention midwives that we funded for every trust within the NHS to support retention. There's no point in getting people in if we can't keep them in. So really, really important in that regard. We also have the NHS England International Recruitment Programme that has seen 500 plus internationally internationally trained midwives from all over the globe that are now in this country supporting our maternity services. And I don't think we'll stop there. It's really important to put our arms around these midwives who have joined our midwifery family, to support them in their walk on their midwifery journey in this country. So if any of you are from international shores on the NHS England International Programme, delighted you're joining us. You're very welcome, and we are grateful. And I hope that we look after you, and I'm sure we will. There's some great things that are happening across England supporting our internationally recruited midwives. But I won't just stop there. During my leadership, we've had aspirant midwifery leaders programs, midwives aspiring to be heads, directors of midwifery programs. I've seen the inception of the midwifery ambassador program. We've got some 97 midwifery ambassadors now who lead the Chief Midwifery Officer Perceptions of Midwifery program. And a part of that program, they're attending schools. They're discussing midwifery as a career of choice with children and young people so that they can think about choosing midwifery as their career of choice. We've got so many initiatives that the midwifery ambassadors are doing, including supporting our PMAs, our professional midwifery advocates, to retain midwives. Just prior to becoming the Chief Midwifery Officer, so I'll still include this, I developed along with colleagues the AEQIP model, the advocating and educating for quality improvement model, when we had that tragic situation with the demise of statutory supervision, and developed that model and the professional midwifery advocate's role. And I remember when I developed that role and wrote the role descriptor, I thought one day we will be able to, across the NHS, replace midwifery with another profession. So instead of professional midwifery advocate, other professions would look at the evidence base behind the AEQIP model and this role and adopt it themselves. And I was delighted when Dame Ruth May, during the pandemic, saw the benefit of the professional midwifery advocate role and decided to invest in the professional nurse advocate role. And I know there are some 4,000 professional nurse advocates that are in our NHS today. And isn't it great that we can say that this started in midwifery? And I saw the growth of 1,320 PMAs. So if there are any PMAs, professional midwifery advocates, in this meeting this evening, I thank you. I applaud you for sticking with it. It's been challenging during the pandemic. The restorative clinical supervision function of the AEQIP model really came into its own. You are all phenomenal. We've provided psychological boost training for all of you during the pandemic, and I just thank you. I thank you for everything that you have done and everything that you continue to do. But not stopping there, we know continuity of carer was an ambition of the Better Births, the report of the National Maternity Review, and indeed is featured in the NHS long-term plan. And because of staffing challenges, we have had to pause in some units until staffing is safe and optimal. For other units, maternity units, where they have safe staffing, they are continuing with continuity of carer, but we must have safe staffing first. And so I know that for those who are from a Black, Asian and minority ethnic background, who are more likely to die than their white counterparts, and their babies are more likely to experience stillbirth and neonatal death, enhanced continuity of carer is being supported for those trusts that have safe staffing in place. I'm not just stopping there. Many of you know, some of you that have been my students know that pelvic health is one of my areas of huge interest, and the development of the perinatal pelvic health service, or services actually, to ensure that all women have access to multidisciplinary pelvic health by 2024 is one of the NHS long-term plan ambitions. We know that the data told us a few years ago that 1 in 3 women would have urinary incontinence within 1 year post-birth, 1 in 10 fecal incontinence, and 1 in 12 pelvic organ prolapse. Now, we can't just sit on our laurels and do nothing about this. So the long-term plan commitment was to ensure that by 2024, every woman had access to a multidisciplinary pelvic health service, and we are well on our way to achieving that. thinking about the perinatal mental health challenges that we have, and but in particular, many of you would have known the Embrace report that was published last year, autumn last year, and the increasing number of women who were dying from who were pregnant and taking their own lives. Death from suicide during pregnancy has increased, and there has been a huge increase actually in the children and young people that are leaving care and taking their own lives who are pregnant, and that is of huge concern. So young people who are leaving our care services who are pregnant, who are taking their own lives. Have a look at the Embrace data and you will be as shocked as I am. And so what are we doing in that space? Well, in the long-term plan, which was published some 3 years ago now, some 4 years ago if we acknowledge the pandemic, in that plan, the perinatal mental health services, the aim was to have at least circa 66,000 women with moderate severe perinatal mental health difficulties to access care in the community by 2023-24. And so we are well on our way toward achieving that. And what's really exciting for me about the perinatal mental health service is if you are a partner of somebody who is pregnant, be you male or female, you will have the opportunity to have support if you need it in the perinatal mental health space. You do not have had to have been pregnant, but you can have support if you are a partner of the person that has given birth in terms of mental health. So I'm really delighted that we're now helping partners too. In the midwifery ambassador space, I think I've mentioned them already. We also have nearly 100 midwifery ambassadors, so I'm delighted in that regard. I would say that you, since the start of the pandemic, have supported the birth of 1,600 babies every single day, which works out to be roughly one birth every 54 seconds. Thank you. What you do matters, and your contribution is significant. And as I said earlier, what you do will ripple through generations. Everybody talks about that. Every woman will talk about their midwife. But finally, I'm going into a new role as the Chief Midwife for the International Confederation of Midwives. And those data that I shared with you, those global estimations of 810 maternal deaths every day and a stillbirth every 16 seconds globally. These are global estimations. I'm really enthusiastic about supporting midwives across countries to be the best that they can be within the infrastructure that they have. And I dare say that my role may well include influencing those who have the power to really value women and where they stand in community and really invest in women's health. Because if we invest in women, then the rest of the life course will be a lot better, I think, I hypothesize. So I'm really enthusiastic about being the first Chief Midwife for the ICM. I'm looking forward to identifying issues and developing policy that maintains the ICM's position as the global, credible, authentic voice of midwifery. I have aspirations to advocate for and represent the interests of midwives and the midwifery profession globally. Really looking forward to that. And despite the diverse challenges faced by regulated and unregulated midwives, I truly believe that amplifying and embedding the ICM's, the International Confederation of Midwives, professional framework, pressing into the Lancet series that looks at the evidence behind the contribution that a midwife makes in terms of improving outcomes and saving lives, I believe that this all will be beneficial because, you know, the investment in midwifery education and training globally to agreed international standards yields significant return on investment. And how amazing is that? We just need that to be heard, to be really heard, to be really understood, to make a fundamental difference. And actually my vision, if I might end on this, I see a future across the globe. And you might well see the end of this vision because it might take us, I don't know, another 40 years, 50 years to get to this point. But I see a future where every woman and baby regardless of ethnicity, skin colour and socioeconomic status, will have the same maternity experiences and health outcomes as those who have the best experiences. So regardless of the socioeconomic status of the woman, their ethnicity, their skin colour, they will have the same maternity experiences and health outcomes as those who have the best experiences. So I wish you well on the cusp of IDM, International Day of the Midwife. Remember to, Sue alluded to it earlier, be kind to each other, celebrate each other, and give yourselves and each other a pat on the back. And thank you for listening.